Good afternoon all. I am Dr. Tirthankar Mohanty. I am a nephrologist in Manipal Hospital Ghaziabad. Today I will be telling you about cystic kidney diseases. Cysts are fluid-filled structures, very much like the holy balloons that the children play with during the festival of Holi. And cysts are pretty common. If you take the age group of 50 to 70 year old individuals, then 10% might be having a cyst. And if you consider people older than 70 years, 20 to 30% might be having a cyst. So most of the time it's a common and innocuous finding. The finding of a cyst hardly raises an alarm. But under two circumstances, it has implications for health. One is when the cyst is not simple. Simple cysts are cysts which have a very clean uniform wall and they contain a clear fluid. But when the wall is thick and irregular, when there is a solid component, then that may indicate something sinister. Second circumstances is when the cysts are a manifestation of some genetic kidney problem which has a potential for damaging your kidney and leading to kidney failure, then that is called then that is considered relevant. And this second group of kidney diseases are called cystic kidney diseases, the commonest of which is ADPKD, which stands for autosomal dominant polycystic kidney disease. These are genetic diseases due to two mutations. The first one is called PKD1, which is more common, the second being PKD2. And in this disease, the kidney tubules, as you know, the unit of kidney, the functional unit of kidney is called nephron, and it has a pipe-like structure called tubules. Each nephron has a tubule. So when the tubule does not know when to stop multiplying, then what happens? The outpouchings form, and gradually the outpouching of the tubule increase in size, and ultimately it separates out of the tubule. And this process in fact starts within the mother's womb. When the baby is in the mother's womb, then this formation of cyst actually starts, and as time passes, with the age the cyst increase in number as well as in size. So ultimately they replace the entire normal kidney and lead to kidney failure. People who have PKD2 mutations, they typically develop kidney failure leading dialysis at the age of 75, etc. But the people who have PKD1 mutation, which is considered to be a sinister mutation, they may land up in dialysis a decade or two earlier than PKD2. So the cystic kidney disease, especially the autosomal dominant polycystic kidney disease, these are systemic disorders, means they not only involve the kidney, they also involve other organs of the body, for example brain, heart, etc. So the treatment of ADPKD is that your doctor advises you to take plenty of oral fluids, to cut down on your salt intake, and they try to control your BP to very strict levels. The systolic BP below 120 with the help of a group of medications called ACE inhibitor or ARP. And people who have very high rate of cyst growth, they are called rapid progressors, and these people are candidate for a specific medication called tolvaptan. The other diseases that come under this group are the other one being ARPKD, which is autosomal recessive polycystic kidney disease, which presents at a younger age. And there are some rarer diseases also where the cysts themselves may not be causing the kidney failure, but those are actually an easily picked up manifestation of the genetic problem that has potential for damaging your kidneys. Those diseases are relatively rare, a few examples being tuberous sclerosis, nephronothesis, etc. So that is all for today. Namaste.